Limitation of flexion of the knee. This is diagnostic code 5257. The highest scheduler rating for limitation of flexion of the knee is 30%, and it includes the following symptoms: recurrent subluxation or instability, unrepaired or failed repair of complete ligament tear causing persistent instability, and a medical provider prescribes both the assistive device, like a cane, crutches, walker, and bracing for ambulation. Typically, the ratings are 0, 10, 20%, 30% at the high side, but there's 3 different ratings for the knee that you need to be aware of. If you have instability, flexion, and extension problems, you can get 3 ratings. The VA loves to lump these together. This is one where you actually need a strategy. You need to have a doctor pull the symptoms apart and associate them with the different diagnostic codes. So if you deserve 3 separate ratings for your knee, you get them. If you need help doing this, here's an email address. Contact my med team. They're good at this stuff. They can help you with the medical evidence piece. In this case, it would be the nexus. If you have unfavorable ankylosis of the knee, it's rated under diagnostic code 5256. This has ratings of 30, 40, 50, and 60%, depending on the frequency, severity, and duration of the symptoms, to include range of motion. So this is measured in degrees. You're going to use a little plastic thing that looks like a protractor. It's called a goniometer, and it's literally, they're going to put it on your knee in your C&P exam, and you should do this before you file your claim. You should have your doctor writing the diagnosis when he's measuring the symptoms and writing your nexus. He should have a goniometer on you. So when you go to your C&P exam, you already have range of motion. You kind of know what to expect in your C&P exam because you've already kind of gone through this. And, more importantly, if they lowball you, you'll have your own medical evidence to appeal theirs with. If you want to learn more about the VA claims process, check out my bootcamp at combatcraig.com. And if you need medical evidence, this is a perfect example of where you would need it. Need a nexus. Contact my med team. There's an email address in the description.